Most men over 60 are taking something every single day that could be quietly making their prostate worse. Not a medication, not a bad habit they picked up recently. Something sitting in their kitchen right now, something they've been told is harmless, maybe even healthy. And the damage it's doing is slow, invisible, and cumulative. Meanwhile, something else, something most men have never heard of, something that grows in the ground and has been studied in clinical settings for years, may actually work with your body to reduce the inflammation, the swelling, the pressure, the sleepless nights. Here's the question that should be on your mind right now. What if the answer to your prostate symptoms isn't another prescription, isn't another surgery consult, but something that was available this whole time and nobody thought to tell you about it? That question deserves a real answer. But first, I want you to understand why this matters right now, tonight, not someday. Because the men who keep waiting for things to get bad enough to act are the ones who end up with fewer options. I'm Dr. Natalie Parker, and if you want to keep receiving important content about men's health after 60, subscribe to the channel and hit the bell. Because what I'm about to explain changes the way you think about your prostate entirely. Most men have been given the same story for decades. Prostate gets bigger as you age. That's just how it is. Take this medication, manage the symptoms, come back in 6 months. And for some men, that approach is appropriate and necessary. But there is an enormous gap between what men are told and what the research actually shows about the biological mechanisms driving prostate inflammation and growth. Inside that gap, there is something real, something actionable, something you can begin using before the end of today. Let's start with what's actually happening inside the prostate when you're over 60, because most men have a simplified picture that's missing something critical. The prostate isn't just growing like a balloon filling with air, it's inflamed. There's a process happening inside the tissue itself. Chronic, low-grade inflammation is one of the primary drivers of both prostate growth and the severity of the symptoms you feel every day. Not the only driver, but a significant one. And here's what makes this matter so much. Inflammation is not fixed. It responds to what you eat, what you absorb, what signals you send into your bloodstream every single day. Your prostate is not sealed off from the rest of your body. It is a living tissue surrounded by blood vessels, nerve endings, and immune cells, all of which are influenced by the biochemical environment you create through your daily choices. That means the environment is changeable. And that changes everything. Now, what does that have to do with a root? This is where it gets specific. There's a plant called stinging nettle. You may have brushed against it hiking at some point and ended up with a rash on your leg. But the root of that plant, not the leaf, the root, has been the subject of a growing body of clinical research looking at its effect on the prostate and on the hormonal and inflammatory environment around it. And what that research has found is genuinely worth your attention. Stinging nettle root contains compounds that appear to inhibit a specific protein called sex hormone binding globulin, commonly called SHBG. Most men over 60 have never heard of SHBG, and that's a problem because what it does directly affects what happens to your prostate. SHBG is a protein that circulates in your blood and binds to hormones, particularly testosterone and estrogen. When SHBG binds to testosterone, that testosterone becomes inactive. Your body can't use it. And when free testosterone drops, while estrogen levels remain relatively higher, as they often do in men over 60 due to increased conversion of testosterone to estrogen by fat tissue, the prostate is exposed to a hormonal environment that actively drives growth and inflammation. Nettle root compounds appear to bind to SHBG before the hormones do, essentially occupying that binding site, which means more free testosterone stays available and the hormonal balance that feeds prostate inflammation starts to shift. Does this shrink the prostate overnight? No. Let's be completely clear about that. Tissue change takes time. But what it can do, and what studies have observed, is reduce the symptoms driven by that inflammatory hormonal environment, the urgency, the incomplete emptying, the nighttime waking, often within weeks rather than months. But here's where a lot of men make a critical mistake. They hear about nettle root, go buy a supplement, take it for 4 days, feel no dramatic difference, and throw it out. That is not how biology works. You are dealing with a system that has been in a state of chronic inflammation for years. Shifting that system requires consistency, the right form of the plant, the right dose, and removing the things that are working against you at the same time. Because the same week a man adds nettle root to his routine, he might also be eating processed foods loaded with refined seed oils, drinking 2 large glasses of juice at dinner, and sitting for 8 hours straight with the blood supply to his pelvic region constricted. You cannot add something beneficial on one end while the other end stays wide open. The system has to come together. So let me give you the full picture, not just the root, but the environment it has to work inside. The first thing to understand is the relationship between inflammation and dietary fat. Refined seed oils, which include corn oil, soybean oil, sunflower oil, and canola oil, are extremely high in omega-6 fatty acids. When omega-6 intake dramatically outweighs omega-3 intake, which describes most men eating a modern Western diet, the body's inflammatory signaling tilts hard toward chronic inflammation. Your prostate tissue is not immune to this. Every meal heavy in those oils is sending an inflammatory signal into the same tissue you're trying to calm. Switching to olive oil, adding fatty fish twice a week, or starting a quality omega-3 supplement begins shifting that ratio, not overnight but consistently over weeks. The second dietary factor is sugar. This one is uncomfortable because sugar is everywhere and most men genuinely don't realize how much they're consuming. Here's the mechanism that matters. Elevated blood sugar drives a process called glycation, where glucose molecules attach to proteins in your tissue, damaging them and triggering an immune response. Chronic elevated blood sugar also increases a hormone called IGF-1, which has been linked in multiple studies to prostate cell growth. This doesn't mean going on an extreme diet. It means looking honestly at your actual intake. Late-night snacks, sweetened drinks, white bread at every meal. These are not neutral choices when prostate tissue is already inflamed. Now, let's go deeper on the nettle root mechanism because understanding this is what makes the decision informed rather than blind. Beyond its effect on SHBG, stinging nettle root contains lectins and polysaccharides that have shown anti-inflammatory properties in laboratory studies. Some research has also examined its potential to influence the aromatase enzyme, which is responsible for converting testosterone to estrogen in fat tissue. Excess aromatase activity is one of the key reasons estrogen levels rise in men over 60 who carry extra abdominal weight. That hormonal shift has direct effects on the prostate. Nettle root compounds may help moderate that conversion, though the evidence here is promising rather than definitive. Individual results vary, but the convergence of mechanisms, SHBG inhibition, anti-inflammatory activity, potential aromatase modulation, makes it one of the more biologically coherent botanical options in the prostate health space. What does the clinical picture look like specifically? A double-blind study published in Phytomedicine compared nettle root extract to placebo in men with lower urinary tract symptoms associated with benign prostate enlargement. Over 6 months, the group receiving nettle root showed statistically significant improvements in urinary flow rate, symptom scores, and quality of life measures compared to placebo. That's not anecdote, that's a controlled trial. And it sits within a broader body of evidence that includes additional trials with similar findings and a long record of use in European medicine, where nettle root has been part of standard prostate care protocols for decades. Here's something that surprises most American men. Germany's regulatory equivalent of the FDA, the Commission E, formally approved stinging nettle root as a treatment for urinary problems associated with prostate enlargement. This has been evaluated by regulatory scientists and found to meet a standard of evidence. Most men in America have never been told about it because it doesn't generate pharmaceutical revenue. When looking for nettle root, you want the root specifically, not the leaf. The leaf has different properties, and while it has its own uses, the clinical research on prostate health is based on the root. Look for a standardized extract. A commonly studied dose range in the published research is between 300 and 600 milligrams of root extract daily, often split across 2 doses taken with meals. This is not a personal prescription because I don't know your full health picture or your medications. It is what the research has used and what is worth discussing with your physician. And if you are currently on medication for your prostate, have that conversation before adding anything new. Herb and drug interactions are real, and your doctor needs the complete picture. And if you want a structured clinical resource covering exactly which mistakes men over 60 are making that silently damage the prostate over time, the medical guide to avoid the mistakes that damage the prostate. After 60 is available in the pinned comment below this video. It covers dietary patterns, hormonal factors, lifestyle habits, and the specific questions worth raising with your urologist. It's the clinical companion to everything we're covering here. Let's talk about zinc because it connects directly to everything we've discussed. The prostate has the highest concentration of zinc of any organ in the human body. Zinc plays a critical role in regulating the enzyme that converts testosterone to DHT, the form of testosterone most directly linked to prostate cell growth. It also supports immune function within prostate tissue and helps regulate inflammatory pathways. Men over 60 are disproportionately zinc deficient, often without knowing it. The deficiency builds gradually, not dramatically, but its effect on the prostate over years is real. Foods highest in bioavailable zinc include oysters, red meat, and pumpkin seeds. If your diet is consistently low in these, a zinc supplement in the range of 15 to 30 milligrams daily is worth discussing with your doctor. One critical point though, more is not better with zinc. Excess supplementation for extended periods can impair copper absorption and create new problems. Guidance matters here. Now here's something almost no one connects to the prostate. Pelvic circulation. Your prostate sits in a region of the body that is particularly vulnerable to poor blood flow. If you sit for most of the day, and most men over 60 do, the blood supply to the pelvic region is chronically compressed. Reduced circulation means reduced oxygen delivery to tissue, reduced immune surveillance, and slower clearing of inflammatory byproducts. The tissue sits in its own waste products, and inflammation doesn't resolve the way it should. This is one of the reasons men who walk regularly report better urinary symptoms even when prostate size on imaging hasn't changed. Movement improves pelvic circulation. It's not mysterious, it's plumbing. A 10 to 15-minute walk after your 2 largest meals is one of the simplest things you can add, not a cardio session, just movement. The gentle muscle contractions in your legs act as a pump, driving blood flow out of the pelvis and pulling fresh oxygenated blood in. Combined with the dietary changes we've discussed, this creates a physiological environment where compounds like nettle root actually have a chance to work because the tissue is receiving the circulation and oxygen it needs to respond. Let me tell you about a man I'll call Raymond, 67 years old, retired contractor. He'd been living with what he called the 3 o'clock alarm, meaning his bladder, for almost 4 years. He'd been on medication for 2 of those years. It helped somewhat with urgency, but nighttime waking was still happening twice, sometimes 3 times. When he came in, I went through his full picture. His diet was high in seed oils. He ate almost no fatty fish, and his zinc intake was negligible. His free testosterone was low, his SHBG was elevated, and his estrogen was higher than expected for his weight. This was not a man who needed more medication. This was a man whose system had been quietly tipped in the wrong direction by dietary factors he didn't know about and a hormonal shift that had never been explained to him. Over about 10 weeks, with dietary changes, a conversation with his prescribing physician about adding nettle root extract and zinc at appropriate doses, and a commitment to daily walking, his nighttime trips dropped to 1. Most nights, none. His symptom scores on validated questionnaires fell significantly. His anatomy on ultrasound hadn't changed, his biochemistry had. Then there's Douglas, 71, former engineer, analytical about everything. He'd been researching prostate health on his own for months and arrived with an impressive and incoherent supplement stack. Saw palmetto, pumpkin seed oil, lycopene, selenium, green tea extract, and several others. None at doses supported by the research, none coordinated with awareness of how they interacted with his blood pressure medication. And underneath all of it, his diet was still full of processed foods and refined oils. He was sitting 8 to 10 hours a day. No amount of supplementation overcomes a foundation that's actively working against you. We simplified everything, removed the uncoordinated stack, fixed the dietary foundation, added back only the two things with the strongest evidence for his specific situation. 3 months later, he described it as the best his bladder had behaved in 6 years. The lesson is the same in both cases. The question is not whether a natural approach can work. The question is whether you are building something coherent or just adding ingredients on top of a broken system and hoping one of them sticks. A coherent approach looks like this. Address the inflammatory dietary drivers first. Reduce refined seed oils. Reduce sugar load. Add omega-3 sources. Support the hormonal environment by addressing zinc status, and if abdominal weight is elevated, moving toward moderate reduction over time. Support pelvic circulation through daily movement. And within that foundation, compounds like nettle root have the biochemical environment where they can actually do what the research suggests. What to avoid is the pattern that defeats most men. Read about something, buy the supplement, change nothing else. Get minimal results. Conclude natural approaches are useless. The supplement wasn't useless. The foundation wasn't there. Without the foundation, nothing, pharmaceutical or botanical, can carry the full weight. If you are on prescribed medication for your prostate, do not stop it based on what you heard in a video. That decision belongs to you and your physician with your full lab work in front of both of you. What I am saying is that the evidence for several natural compounds is real, is clinically validated, and belongs in the conversation you have with your doctor. You being informed makes that conversation better. It does not replace the conversation. If you're experiencing blood in your urine, sudden inability to urinate, severe pelvic pain, unexplained weight loss, or fever alongside urinary symptoms, those are not lifestyle situations. Those are warning signs that need clinical evaluation immediately. Everything discussed today lives in the space of chronic, manageable symptoms where informed changes can make a meaningful difference. That space is large. It contains a lot of men who could be doing significantly better than they are right now. So let's come back to the question we started with. What if the answer to your prostate symptoms isn't just another prescription, but something that works with your body's own biology to reduce the conditions driving the problem? For a meaningful number of men, it is exactly that. The research on inflammatory diet, hormonal environment, pelvic circulation, and compounds like stinging nettle root doesn't live on the fringe. It lives in peer-reviewed journals and regulatory approvals and the clinical experience of physicians who look at the whole picture. You deserve to know about it. You deserve to walk into your doctor's office with this information and have a real conversation, not wait until things are severe enough to require more aggressive intervention. The choices you make starting today affect what that tissue does over the coming weeks and months. Your body is not your enemy here. It is responding to the environment you have created around it. Change that environment deliberately and consistently, and you give it the real chance to respond differently. If you want to keep receiving this kind of content, the research, the practical strategies, the things most doctors don't have time to explain in a 7-minute office visit, subscribe to the channel and turn on notifications. Because what comes next connects directly to everything we just covered.